At the beginning and early on, we were always able to explain and to negotiate what we wanted to do. And the groups allowed us to work in the way that we usually work. So we use our own medicines. We can make sure that our medicines are getting to the people we want them to go to. We can make sure that any patient can access our hospital. We can make sure that once the patient leaves the hospital, they are going to be able to access follow-up in our hospital again. That there's no restrictions on the way that we can provide medical care. As time went on, that became more difficult to negotiate with the groups in our areas. They changed a lot. They became increasingly demanding about the care that we provided and tried to put more and more restrictions on what we did. In particular, when the Islamic State group arrived, at the beginning we did the usual negotiations, the usual discussion, and they were very happy for us to continue our work in the hospital in which we were working at the time. Gradually, as time went on, more and more they were not allowing us to do what we would like to do. They were not allowing all the patients to access the hospital. They were starting to use some of our supplies, to borrow some of our equipment. And then eventually, as we know, this led to the kidnapping of our colleagues in another project. That was almost like a failure for us in terms of negotiation. We've always prided ourselves on being able to reach local agreements with these groups, and at this point the local agreement fell apart, and it was very clear that we couldn't really work in a place where they wouldn't allow us to do our medical job. Despite the release of our colleagues by Islamic State, we haven't received the guarantees for security to allow our international and national staff to work in those areas, and we don't feel that we'd be autonomous to work in those areas. So that leaves a huge part of the country that we're unable to access or to provide any humanitarian aid. We know the needs in Syria are huge. About 50% of the population have been displaced from their homes, some of them outside Syria, many of them within Syria. There's only a small part of the country we can access, and we work in that area. We know there's still huge needs of war trauma continues to happen, but at the same time, as the Syrian health service has not really been functional in these areas for the last coming up to 4 years, then there's now huge needs of chronic disease, maternity care, paediatric care, all the health needs you'd expect in any country that are just not being met. So we're trying to work there. We're running a hospital, and that hospital we've really identified one major need as being burns. There's so many burns cases inside Syria these days, and they seem to have increased since the onset of the conflict. People are living in really vulnerable situations. They're living in tents, they're living in abandoned buildings, and it's very cold in Syria in the winter. That means that they have to heat their homes. With there being no electricity and very difficult access to quality fuel, they often use poor quality fuel, some poor quality kerosene that they burn in stoves, and these stoves explode. So we find that there's many injuries from fuel explosions happening inside the domestic environment, inside people's homes. Being outside the country, not being able to go inside, and just knowing the violence that's happening in there, that every day there's bombings, every day there's deaths, there's casualties, and not being able to do very much about that. For me personally, as a doctor, that's just incredibly frustrating and quite depressing. I mean, at least we are managing to try and address some of the needs. We're managing to try and support what is happening inside Syria. But it's very difficult to see where we go from here and where the country will go from here. I can't really imagine Syria in 4 more years' time. I can't see where it's going to end up. I'd hope that things get better, but at the moment, I mean, it seems to have hit a stalemate in terms of what we can do inside that country, although we keep trying.